So here we are.
Hello again.
Hello.
Yeah,
Hello.
amazing. Today's episode is all about HRT.
HRT day.
HRT Day. Hype, hope, and honest truths. I mean, for me, HRT is like word association game to menopause. It's kind of like you've got menopause, get on HRT, and my friends that I know, that's kind of it. You know,
That's their solution.
yeah, that's my perspective of HRT is kind of what word association game. But, you know, Julie, I know you've got a totally different experience related to HRT.
Yeah, so I mean, I've been through gynae over the years, and I've had issues with taking the pill, and HRT is just not an option for me. So I've never ever taken HRT, but whereas for somebody like my mum, it worked really, really well, and she's a very, very strong advocate of HRT.
How old's your mum, if you don't mind, if she doesn't mind me asking?
So she's now 80.
Right. So that's quite a big wow for her to be an advocate of HRT from 30 years ago, or whatever. That's
Yeah.
doing that. Good
Yeah.
on her. So, two extremes.
Absolutely. And she was, as soon as I said I've been told that I'm menopausal, she was like, HRT. And I was like, but you know what my medical history is? I can't take HRT.
Yeah.
And she's never been able to get over that, because to her, it was wonderful.
Yeah.
Yeah, and
Helped her so much.
isn't this the thing about HRT is it's so polarizing. It's kind of, you're on one podcast or one Instagram account and you're an absolute idiot if you don't take HRT, because it's the kind of like mecca of solutions for HRT. And then you scroll down or go on another podcast and you're an absolute idiot if you take HRT, because there are all these other solutions out there and it's got all these risks associated, and why would you put that in your body? So, no wonder people are confused, and we use the word hype in the title. We don't know what to do. We want to do the best of ourselves and we want to do it, but we're also scared, or we think we should do it, but there's something that makes us feel uncomfortable about it. And what it ultimately comes down to is personal choice.
Right.
And if our listeners take away anything from this episode, it's, as always, arm yourself with knowledge, and it's your choice. There isn't a right or a wrong. We're not here to advocate HRT, and nor are we here to diss it. We're here to give the facts and let people make the right decision for them.
Yeah. Well, it's interesting. I mean, my personal take on it is, it's never sort of sat well with me, and I do try to go down the natural, holistic view, and not to put foreign things in my body that aren't naturally there. So I've kept away from it. But again, I don't have any sort of opinion if someone's taking HRT. I don't kind of think, what you're doing that for. So why is it like so polarized? Like why is it it's got this?
I mean, I think there was a
tension.
small proportion of the population that took HRT until the early 2000s, when this research came out that told everybody that HRT would give you breast cancer.
Yeah.
And which has since been proven incorrect on lots of different levels. The kind of the specimen size, the HRT that was being used on that particular trial. So that it's been proven that was not correct, and it actually, it's a shame, because it put so many people off HRT for a long time. But there is still a hang up from that. So there's still, there's still an association with HRT giving you breast cancer. So there's still a hang up from that. There's also the fact that medical training is so poor. And GPs will say this themselves, they get very little time on it. So going to your GP and expecting them to be the experts is misguided, because they're not. So that happens. We've got social media. So, all over social media, there's the pros and the cons, there's the shoulds and the shouldn'ts. And that, that can be quite distressing. If you're not feeling very well and you want a solution and you think there might be one out there, and someone goes, yeah, this is fantastic, and somebody else is going, no, don't do that. That can be quite soul destroying. And very often, unfortunately, that's driven by personal gain, because people are trying to sell something, whether it's holistic lifestyle solution, here we go, pay for that, or, a private HRT clinic or something. So that's basically why those three factors. But a lot of it for me, it dates back to that outdated research that still lingers 20 odd years later.
Yeah, I do agree with that. I mean, there's a thread of me thinking, oh, there's a link, So I think
no smoke without fire kind
yeah,
of thing.
absolutely.
Yeah.
I think I'm pretty typical of what most of our listeners will be thinking is.
And I struggle, if I'm speaking to women who have that view, I struggle to bring them round,
Yeah.
even faced with the correct information.
Yeah.
It's hard to bring people back round, which is fine. But sometimes it's a shame because people miss out on a solution that would help them.
Yeah.
See, I have to really explain to people that it's because of medical reasons that I cannot take it. It's not because I don't want to take it. It's because I just can't take it.
Yeah.
Well, let's not forget, if if any lady doesn't want to take it for whatever reason, that's fine as well.
Yeah.
You don't have to give people a reason why you're choosing not to take HRT, or indeed you're choosing to take it.
Yeah.
That's your personal decision.
Yeah.
Yeah. Back off.
Yeah. It's true, isn't it?
Yeah.
Yeah, it's right. And that's the point, isn't it? Is we do have a choice.
Yes.
And that kind of goes back to my opening gambit of, people think menopause, I have to go on HRT. That's the only way. I do think there's a lot of that going around. There's friends of mine who have almost got a smell of menopause, or I'm at this age, so I'm going to go to the doctors and get some patches, or whatever it is, So yeah, but I'm loving that the choice thing is the big
choice.
message.
Informed choice.
Yeah. So with regards to HRT, what actually is it? And, Karen, can I make a request that you do this in like English, plain English, not some kind of foreign language?
Okay. Simple, I can do.
That's amazing.
So basically, HRT is a series of hormones that put into your body to replace the hormones that are in decline. That's what you're doing. You're putting those hormones back into your body. And the three hormones that we're talking about are, as we probably all know now, are progesterone, estrogen, and testosterone. Now, the main one that will fix some of your symptoms is estrogen. So by putting estrogen back into your body, things like your hot flashes, it's, women I speak to, it fixes their hot flashes in a couple of weeks.
Mm-hmm.
So it's massive, that. But sleep, anxiety, mood. If you think of any of the symptoms that are related to a lack of estrogen that we've talked about in previous episodes, then HRT will help with some. Estrogen will help with some of those.
Right.
And just to be clear, estrogen that we take now is absolutely natural. Most prescriptions that you will get is absolutely natural. It's called body identical, so it's identical to the estrogen your body produces. The one that was used in previous generations, and the one that the research that was mentioned is related to, was actually completely synthetic, actually derived from male horses' urine. That's where it came from. So that's just a kind of like a highlight for people to think about. Is you must be asking for body identical progesterone. So that's estrogen. Yeah, I get confused. No wonder everybody else does. Estrogen, and then that is normally most prescriptions, not all, but that would be most prescriptions for HRT. The second one that will be in many prescriptions is progesterone, and that's required if you still have a womb. Because it will protect your womb lining. It's the thing that in early life is released to protect your womb lining. So that's why you would need progesterone. But in addition to that, progesterone can have a calming effect. So it can also help your mood. It can help you sleep. It can just make you feel a little bit more chilled. So in most NHS prescriptions, those are the two hormones that will be prescribed. Certainly estrogen. Very often progesterone attached, and it depends on the stage of menopause that you're in as to what that will. This episode isn't meant to be a science lesson; it's meant to be an educational. Just ask you some questions, the questions that you should be asking.
Yeah.
And then the final hormone, which not everyone is aware of, is testosterone. So we still have testosterone in our body, even though it's predominantly a male hormone. And testosterone declines in the same way the other two hormones do. So this can affect, just think of it as the male hormone, your energy and your va-va-voom, and also your libido. So, I've met many women who say that taking testosterone has literally changed their lives. It's more difficult to get hold of, certainly in the UK, because it's not on license as a HRT menopause drug. However, with the right information, some GPs will prescribe it because it has been proven very, very safe. And especially if libido is the thing that you're being affected by. If you've already tried estrogen and progesterone and that isn't working, then I call it the third line of defense. It's not advisable to start with testosterone because you've got to fix your other hormones, which are more abundant in your body anyway. But as a third line for libido, especially, but for some get up and go, then testosterone can be prescribed either through your GP on the NHS or through one of the private clinics that exist. So I know women who I've got all sorts of combinations that have worked for them over a period of time. It's a bit of trial and error.
Yeah.
The dosage, can impact, but they're the three, with estrogen being the one that will have the biggest impact on your hormones. Remembering, obviously, that it's part of a toolkit that we said earlier.
Yeah.
So don't expect to go on HRT, pump your body with these hormones and everything's fixed.
Yeah.
If you're still eating badly, if you're not sleeping well, if your exercise is all over the place, if you're stressed to high heaven, it's not going to fix it for you.
Yeah.
It won't fix weight gain, for example.
Yeah.
But they're the three that you will be needing.
I think you get 10 out of 10. Great
Was
explanation.
that simple enough?
Yeah, I like that. 3 key blocks. The first 2 are really important, and the third one, top up if required.
Yeah.
Yeah.
But it's all a bit of a mix-up, so you need to find the right combos
Yeah, absolutely.
for your situation.
Wow. Thank you.
You're welcome.
So now the question is, how do we take this?
Okay, also complicated. And I don't want to be too specific here because it can wind people up in knots. If, you hear a snippet of something, you think that's what I need.
Yeah.
But basically, estrogen normally now will be prescribed transdermally. So that means it goes in through your skin rather than through your liver. So all prescriptions will be an oral. It's got to go through your liver. So some of the risks that may be associating people's heads with taking these hormones are eliminated by the fact it doesn't go through your liver and it goes through your skin. And it's also better absorbed, so it gets into your bloodstream more easily.
Right.
So usually estrogen will be prescribed as a patch,
Yeah.
or a gel.
Right.
Some women find that doesn't work for them. They're poor absorbers, so the body identical pill will be an option, but as long as it's body identical.
Right.
Estrogen can also be prescribed vaginally. So if you've got, kind of any down below issues with dryness or loss of laxity, etc., then the prescriptions are available for that, and that helps lots of women. And that can be taken as well as the other forms, either the oral or the transdermal. And then we have progesterone, which is normally a pill, or it can be a combined patch with estrogen. And if it's the pill, you obviously take that as a pill. And if the pill doesn't work for you, or you find the pill bloats you, then you can actually insert that vaginally as well. Some women do that quite well. Another way of getting hold of progesterone is through the Mirena coil. So that will release, albeit slightly synthetic, but it's proven to be safe. So that's another way of getting it if you don't want to take the pill. And it also obviously doubles up as a contraceptive as well if you're perimenopausal at the time. So they're the main forms, but they can be combined, they can be separate, they can be patches, they can be gels, they can be tablets. It's a question of tracking your symptoms, understanding what you're trying to achieve, know about your lifestyle and your risks, and talking to your GP or your HRT provider. And then there's testosterone, which we said earlier isn't available on license as HRT. There's a female version of it, and there's also a male version of it, both of which can be prescribed in small doses, usually as a cream or a gel. So it's quite difficult to get your head around, and I think the take for our listeners is it is complicated, but that doesn't mean it's not doable. Start with something that feels safe to you, that feels comfortable to you. See how that works. Start in a lower dose. I would recommend a couple of pumps at night and a progesterone tablet, and see how it works for you.
Yeah.
And then, but be prepared to take time to make it work. Some people, within a week, oh, that's great, it's all good. Some people have slight side effects. Some people think this isn't working. 3 weeks in, this isn't working. We need to give it 3 months to see the impact. So it is a bit of a game of patience to be played.
Yeah.
But if your symptoms, your hot flashes, especially your anxiety, sleep, all these things, it can have huge impact. So it is worth sticking at.
Yeah.
And then going back and tweaking it, you know, saying to your GP or your provider, this isn't working for me. Please, can we tweak it? You know, some people don't like patches because they bring them out in rashes, so try the gel. Some people don't like the combination patch, so split it out.
Yeah.
And then the prescription changes as you go through perimenopause, when you're having a bleed and when you're not having a bleed. So kind of do your homework, find out what's best for you, and go and ask for that. And then take your doctor's advice and, you know, talk to your girlfriends, see what's working for them. That, not saying because it works for Carol, it'll work for you, but just listen to other people's stories.
Yeah. Yeah, it's amazing. So, Julie, do you have, you know, any vibe from colleagues at work who are on HRT? I don't just.
Not necessarily colleagues at work.
Okay.
Definitely outside of work. So, you know, I've got best friends who absolutely swear by it.
Yeah.
And again, it's very much, you know, I can't believe you're not taking HRT.
Yeah.
And then it's actually, well, you know, we've had this conversation quite a few times.
Yeah.
And yeah, to them, it's you know, it's
the
worked
lifeline.
wonders. Absolutely.
There's loads of women like that.
Yeah.
Loads of women like that. As long as they're not kind of, you know, pushing it. It's like drug pushers, you know, you've got to take this because it's the right thing to do.
Yeah.
But there is no doubt it works for many, many women.
Yeah.
And it is a lifeline. But even for those women, you know, I always say, still fix everything, you know, still look at all the other lifestyle factors, because however great you think you're feeling, you can feel better by making changes that live midlife and menopause requires beyond just pumping them back.
So what are the benefits then of HRT?
So obviously symptom relief is the biggest one.
Yeah.
It will relieve your symptoms because it's you know, the things that your body's crying out for, it's putting back in. So hot flashes and night sweats are the ones that women talk to me all the time about. And we've had the conversation about whether or not it would help you with yours. And then, you know, the other symptoms, like aching joints, great sleep, because progesterone and the estrogen together. Brain fog, people talk about, you know. I think just that whole generic, if you know what your symptoms are, you'll know that that's helping you.
Yeah.
But if you don't know what your symptoms are, you don't know whether it's helping you or not.
Yeah.
Does that make sense?
Yeah.
The ones that it doesn't really help for are the ones that are symptoms of symptoms, and kind of like meno belly, not great.
Yeah.
Hair, it might help a little bit, but you need other things on top of it. So, you know, the symptoms is the main thing, as long as it's the direct symptoms rather than symptoms of. I think more interesting, and what a lot of people don't know is the benefit HRT can have on your long-term health. So as we approach midlife, and because of the loss of estrogen, we're at risk of heart disease, you know, heart attacks and high cholesterol. And loads of women get tested in midlife, and some of the cholesterol's gone through the roof.
Yeah.
And that's because it's one of the signs of perimenopause. Bone health and osteoporosis. So putting those in can really, you know, can prevent. 1 in 2 women will have some form of osteoporosis after the age of 50, even if it's very mild. So, you know, it can have a massive benefit on that. There's some research out there that's saying it helps with brain health and reduction in the risk of dementia, and then diabetes as well is another one, which is research there. So, you know, the advocates of HRT pump this all the time, going, this is, you know, you're mad because it'll fix your heart, it'll fix your bones, it'll fix this and that. You know, whilst that may be a bit top note in many ways, then there is some truth behind it.
Yeah.
So there are long-term health benefits that, you know, if you're at risk of them, then it might be just worth considering, or at least doing the research to find out whether that's right for you. So I'm not saying to every listener, oh, you should take it for your heart.
Yeah.
Go and investigate it and find out if it's something that might be beneficial to you.
Yeah. So it's great actually to hear that in that succinct way, because for me, it's saying HRT is not going to relieve all the symptoms of the menopause, but it will actually address some of the quite debilitating symptoms.
It will for many women.
Yeah, with some added benefits as well, you know, beyond the menopause symptoms.
Yeah.
So yeah,
and there'll always be the lady who takes HRT with horrendous hot flashes and it doesn't work for her. She tries for a year and it still doesn't work for her.
Yeah.
There's always going to be those examples.
Yeah.
But just kind of in my experience, and if you look at the research, those key symptoms that we associate with menopause can be helped
Yeah.
for a lot of women by taking HRT
Yeah.
alongside the rest of the toolkit.
Yeah. So now let's flip it. What are the risks?
So the risks, in my opinion, are over-egged for most people.
Right.
So historically there's a risk of the hormone type.
Right.
So this, we've mentioned it, so we don't need to repeat it.
Yeah.
The old estrogen was synthetic,
Yeah.
and there was a risk associated. There was a small risk of breast cancer and some heart disease with that. Exaggerated in certain women with a certain medical history, but it was there. But in 99 cases out of 100, that won't be prescribed now. And if you are prescribed a synthetic estrogen, you really need to question why that's the case.
Yeah.
Because that sounds, lots of levels, not right.
Yeah.
And there could be reasons why. There could be medical reasons why, but that sounds not right. So that's the main one that's always been associated with HRT. Second is application. So again, we touched on that. Transdermally, that's a much safer way for you to take your hormones if you can.
Yeah.
Because it's quicker, and also it doesn't have to bypass the liver, so your body's not absorbing it completely. And the third and probably the most important one is personal health history, and that's where the biggest risks. The risks aren't population wide.
Yeah.
They are associated with certain categories, health categories, heart, breast cancer. Some other hormonal conditions.
Yeah.
Then you will be at risk. But your GP will tell you about that.
Yeah.
No, and even then, if I'm honest, challenge your GP because they don't have all the knowledge. That's
Yeah.
the problem.
Yeah.
But that's the biggest risk associated with it.
Yeah.
Is certain health conditions, and the danger being that you hear about a certain health condition and then it's part of the whole population, and that's a risk. And it's not. It's only a risk for that small bit of the population.
Yeah. And that, what you're saying about that just reminds me of your story, Julian. I just think it's worth us just recapping what happened to you, because your doctor suggested it, didn't they?
Yeah.
And yeah, your history's, anyway,
Yeah.
your story.
It
Blows my mind.
It still blows my mind that, it was routine blood tests and having that call from the doctor to say that you're well into the menopause. Would you like some HRT? And that was their instant offering after telling me.
Up your notes.
And they had not looked through my
it's mad.
notes at all. And, my immediate response was, have you looked at my notes before you got on this call with me? Because I cannot take... I can't take the pill, so I'm not going to be able to take HRT.
And there is the inconsistency, because you're going to push down your throat, and there are other women who can't get it because for whatever reason the GP says they're not suitable, or they're too young, or they got this, that, and the other. This is so inconsistent.
Yeah.
Which again, as ever, going armed with the right knowledge is the best way to approach it if you want it.
Yeah. I think this podcast is amazing, actually. I really do. From an education point of view, I mean, it's educated me, so thank you for that. I just think it's...
I think, we're not giving all the facts because it would be a 4-hour podcast if it was, but just there is so much to know. Don't discount anything until you know, and then I have no problem with people saying they do or they don't want HRT, as long as that's an informed decision. It's when my friend said, or my ill-informed GP said, you know your body, get the facts, and then make the right decision for you.
Yeah, and I think now is a good time to say to the listeners that, if you've got any questions, just pop them on the message to us, and then we'll bring it up in future episodes. So any questions, especially about this, then just pop us a line. So that's great. So HRT isn't good for everybody, is that right?
It's not good for everybody. It's good for some people, and some people it might be good for, but they don't want it. It's kind of like three phases, and it's all I can say is it's such a personal decision.
Yeah,
and it drives me mad. These people are out there giving us one view or the other.
Yeah,
because it's not fair on women.
Yeah,
it's not fair when we can't make informed decisions for our own health without feeling we've got it wrong by some influencer.
Yeah,
who's usually got some personal gain.
Yeah.
Yeah.
If you're taking it, it's right for you. If you're not taking it, that's right for you as well.
Yeah.
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 If it's an informed
Yeah.
choice.
Yeah. And then you've also talked about the middle ground, as in, it's not like a forever thing. Is that right? Is that what you mean by that?
Yeah. I mean, some women take HRT forever, and as long as other health conditions allow, that's fine. But if you go on HRT, in fact, I'm a perfect example. When I was at the height of my menopause symptoms, I was on HRT, and it did feel a little bit. I didn't know as much as I know now. I was a little bit, I'm not sure this is right for me. I did it for a while, fixed some symptoms, and then I gradually weaned myself off because that was my choice. I was really focused on lifestyle at that point in time.
Yeah.
So don't think this is a forever thing.
Right.
You try it. It might help you a lot, and you can stay on it. It might help you a lot, and you choose to. I'll just do it for a while. Well, because obviously you won't know because you've got the hormones that you're putting in, but your natural hormones will be falling. So just wean yourself off as the symptoms decrease, and then that's up to you, or stay on it.
Yeah. And when you say you're on it for a while, can I ask how long
I was on it for about 18 months.
Okay. Yeah.
Started off with a lowish dose, struggle with progesterone. It gave me quite bad gut problems. I started inserting it vaginally. Too much information on the pod. And that worked for me. And then I just felt a lot better. And I think because a lot of my symptoms have been symptoms of symptoms.
Yeah.
And I realised that through the course of the journey.
Yeah.
And I just, gradually over a period of about 3 months, just reduced the dose, came off it. And I still get the odd symptom, but for me, that was right.
Yeah.
But that was just for me.
Yeah. 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 It's good. It is good to hear that, it isn't like that, you're either on it or you're off it. It is like about, and the thing is, I suppose it's pointing out the obvious is you saying that, our bodies are changing and evolving, isn't it? So actually the same solution is not right because the symptoms are not necessarily the same.
Yeah. And I think, people sometimes say, well, why are you pumping your body with these hormones when naturally you're getting rid of them?
Yeah.
When naturally you're getting rid of them. And again, this isn't science. This is just something by speaking to women that I've sort of come to the conclusion is 50 years ago, when we had none of these hormones and we were in the kitchen doing not a lot of them other than cook and clean and knit.
Yeah.
Then we probably didn't need them. Now we're expected to be looking after our parents, working in big careers, running around after family, managing finances, looking amazing, going to the gym, all these things. Our bodies are demanding a lot more from us as 50-odd-year-old women than they were a generation and a half, 2 generations ago.
Yeah.
So that's sort of my little caveat.
Yeah.
Is that why we need them more now?
Yeah.
And that's from somebody who's not actually on it, but it's just for people who feel that pressure and the anti-brigade is just think about what you're asking your body to do.
Yeah.
You're asking it to behave like it did when it was 35.
Yeah, exactly. It's true, isn't it?
It is. Yeah.
So
But,
good.
yeah.
Sorry.
No, hype, hope, and honest truths.
Yeah. It's good. Well grounded. That's really good. So what should we feel empowered to ask for?
I feel like a stuck record. Know your own symptoms.
Yeah.
That's what you need to know. Go into, if you choose that HRT is a route that you may want to consider, go to your GP. And actually, there's a resource that we can put at the end that is how to approach your GP appointment, if that's what you want to do, because it's just full of like little snippets about making sure you track your symptoms and the questions to ask, asking for a double appointment, so you've got time to cry for 2 minutes or whatever it is that you want to do. So know what it is that's happened to your body. Know what it is that you think you might want.
Yeah.
Discuss with your GP then the prescription and agree, what it is that might be appropriate for the beginning. It's fairly standard on the NHS, to be honest, what they'll give you for the first prescription. However, if after 3 months that's not working, you're absolutely entitled to go back and say, this isn't working for me. Can we try something else? And explain why it's not working, what's still happening, what side effects you might be having. And, even before that, if in that first meeting, if you're not happy with the outcomes, you're more than entitled to go and ask for another practitioner within that practice, or even go, there are menopause nurses around on the NHS. You might have to wait a long time, but you can get on a waiting list for one of those. And if you're fortunate enough to be able to afford it, looking at some private solutions. So information, knowing what you want, understanding your health, and just being determined to get the right answer for you, and not being, it can, yeah. Antidepressants is very often prescribed.
Oh gosh.
In fact, that was offered to me the first time.
No way.
So you can imagine how that went down. So yeah, just being sure of your facts as much as possible. And it's impossible for us to give listeners the full facts because everyone's different. But that resource at the end will be helpful for everybody.
Yeah.
To complete.
Yeah. It feels like almost like a matching activity, isn't it? It's like, what are the symptoms, and match the right treatment basically for it.
Yeah.
That's really good. Yeah, I like it.
HRT. It's a difficult one. It's a really difficult one. It's so polarizing, not just on social media, but amongst your friends and stuff like that. And there's a bit of a shame both ways.
Yeah.
But if you know what you know, and that's all that matters.
Yeah.
And it's fine to choose not to. It's not just I can.
Yeah.
For whatever reason, if you don't want to take out HRT and you understand the benefits and otherwise, don't take it. Try something else.
Yeah, I like it. So as we bring this episode to a close, any closing thoughts from you, Julia? Let's go.
I think it's just very much that actually, there are a lot of people out there who are not medical practitioners and maybe in your friendship groups who feel that they have the right diagnosis for you. And actually, you need to do what is right for you.
Yeah.
And listen to yourself, not listen, obviously talk to other individuals, but, don't feel pressured into taking on what they feel is right for you when actually it's not right for you.
Yeah.
Mm-hmm.
Yeah. I like it.
Yeah.
It's really good. Yeah. Karen?
I'd like to appeal to the people on either side of the spectrum, the people on this and this side, to please stop being so forceful in your left and right views, because it's not fair, it's not correct, and it's not helpful for anybody. And that drives me mad.
Yeah.
A more balanced approach is very welcome. And then just the point that, HRT is just one piece of your toolkit.
Yeah.
Even at its best, it is just a piece of your toolkit. So let's not overhype it.
Yeah.
Because you can have so many positive outcomes by doing the right things with your lifestyle, nutrition, sleep, exercise, stress levels, etc., etc. So it's part of the toolkit.
Yeah, I love it. And for me, I think what I'm taking from today is the whole. It's a journey, and actually symptoms change, and HRT may be part of it, for part of that journey, but not necessarily HRT, and that's it sorted or not, as the case may be. So yeah, really good episode. Huge subject.
Yeah.
Thank you for making it straightforward.
Well, it's a very small part of a big conversation, but I would appeal to our listeners that if they do have questions, just ask them, and we'll do our best to find solutions, or certainly point you in the right direction.
Yeah. And if our listeners continue listening, I'm sure we're going to touch on a whole pile of things after, because these are all building blocks, aren't they? Each episode is a building block. So you tune in and listen to the whole series, then hopefully you'll walk away with a really good understanding of what's going on.
So you can make the right decisions for you.
Yeah. Great. Thank you so much.
Thank you. Great episode. Speak to you soon.
Take care.